I'm Wendy Rees and I work with the Emergency Care Improvement Support Team. So welcome to the podcast in our ECIST podcast series. This one is about demand and capacity for community teams who provide urgent response. I'm with a colleague of mine called ashish.mohanty.
So, hello everybody, I'm Ash, a technical manager in the National Demand and Capacity team. We're a small team that develops tools, resources and training to support planning with the aim that patients don't wait longer than necessary to receive the care they need. Ultimately, our objective is to share best practice in demand and capacity planning and embed this knowledge at organisation level, empowering colleagues with the skills to carry this out in their own services.
Thanks, Ash. So the mismatch between demand and capacity is crucial, isn't it? Because obviously that can create backlogs and waits for patients. And this is really applicable for community teams as well, because community teams are providing urgent response to keep people at home. They're also really pivotal in the system in terms of providing response to acute hospitals when patients need to come home or in emergency departments. So, is sort of demand and capacity modelling something that community teams can use?
So, demand and capacity, in a nutshell, is all about predicting the required capacity for your service, comparing this against your available capacity, and highlighting and quantifying gaps that may exist. Now, demand and capacity for elective services have been used in acute organisations for some time now. And ultimately, predicting demand and determining the required capacity for a service is underpinned by some fundamental principles. Acute services generally have simple pathways where a patient is referred, is seen or treated, and is then either discharged from the service or moves on to the next phase of their treatment. Now, this differs slightly from community services, where patients may require a number of contacts at the start of their pathway, potentially requiring longer-term care. Now, in 2019, Wendy, you and I actually visited a community urgent response team in Walton Forest so we could learn more about how these teams work. And we actually did a blog about this, and you can read more about that in the ECIST blog. But the principles which are used for demand and capacity planning in acute services can also be used in community services. However, the way these principles are applied need to be tweaked to suit these community services. Now, the urgent response model has been designed to support service planning in a variety of community physical and mental health services.
So, when we talk about urgent response in the community, Ash, this could be community nurses, this could be people in a frailty team, this could be rapid response or urgent crisis teams, both physical and mental health. And really, urgent response model may be appropriate for teams that are providing a same day response or same day emergency care pathway. So, how easy is it for these teams to use a demand and capacity model?
So when we talk about urgent response teams or services, you've already highlighted a number of services which could fall under that umbrella, so to speak, and it's important to consider that the patient requirements and how these services operate will vary from service to service and organisation to organisation. Now, the model is designed around a framework that can be adapted for many different services. So the needs of your patients may vary. For example, some initial assessments may be appropriate to be dealt with over the phone, for example, whilst other assessments would require a face-to-face visit. And again, depending on the outcome of these assessments, a patient may or may not need additional follow-up care from your service. Another consideration is the patient-facing time and travel time involved in responding to and managing these requests for help. This may vary by patient, by pathway, and the skill mix of clinicians involved in patient care. I mean, what we're saying is there are a number of variables which again, these differ from service and from organisation. The model allows you to account for these different variables. Now, important areas to consider are how demand is recorded and what patient-facing time is available using the rota. Now, it's important to acknowledge that a clinician who is on a rota, for example, 37.5 hours a week, that does not mean that the team has 37.5 hours available of patient-facing and travel time from that particular clinician. You need to factor in considerations such as clinical admin, training, supervisions, and other duties which need to be carried out. I mean, that's also not to mention any breaks and things like that, handover time, MDTs, and things such as that. So all of this needs consideration. And this takes some time to think through for teams, especially those who may not be familiar with demand and capacity modeling. However, once you have these conversations, once you get the right people in the right room and actually talk these through, you can actually end up in a position where you can actually set all of this up, and it can be used as an operational tool which can really be powerful in supporting service planning and making your service better, not only for the patients, but also for the clinicians who are actually on the front line running that service day in and day out.
Oh yeah, and we've been fortunate to be able to field test this model with an urgent response team in Hampshire. And it's been, as you've described, Ash, we spent some time with the team sort of describing what clinical capacity there was and the roles and the skill mix in the team. And then we're also able to look at the demand data, which was obviously through their sort of electronic patient record. And actually, once the model had been set up, it was really useful. The team had significant investment following a pilot project. And actually, by using the model, they were able to sort of right size the team and the recruitment, and also now are able to sort of map the increases in demand. So they're using it regularly as an operational tool and an ability to feed back to commissioners as well around the sort of output of the team as well. So that's great. But how can others get a hold of a copy of the model?
So all the offers from the demand and capacity team are free to use for NHS colleagues. The first iteration of the urgent response model is available to download and use on our Futures NHS platform, and there'll be a link to where you can access this, which will be below. This will eventually be made available on our main website alongside our other demand capacity resources for elective, community and mental health, and urgent and emergency care services. In addition to that, on Futures NHS, we're actually hosting a series of demonstrations, and one of them is actually on the urgent response model, where we talk a little bit more about the model itself and the principles underpinning it, but also more about a case study in Hampshire, which Wendy actually alluded to. So we expand upon that a little bit more over there. So again, we'll include a link to that so you can hear more about that.
Oh, so thank you, Ash. And thank you to those that have watched the podcast. Goodbye.